Hello, everyone, and welcome to our very first webinar with the new speaker, Tina Chen. My name is Donna Chow, and I will be your host and your moderator for today's class. Today's free webinar is sponsored by Evergreen Herbs. That's where Tina Chen works, by the way. Today's webinar is recorded and presented by Lotus Institute of Integrative Medicine. And here at eLotus, we have been hosting educational courses for over 2 decades, and we are proud to be your trusted source for premium CU content with over 200 speakers, 700 courses, and 3,000 hours of continuing education. A little bit of housekeeping before we get started here. The webinar is going to run from 2 to 4 p.m. Pacific time. We will have a short break after an hour. The lecture notes for today's class are available for download, and you can find that on the course access page. The chat room. If you would like to participate in the chat, we do ask that you set your chat to everyone or all panelists and attendees, because by default, Zoom sets it to host and panelist view only. So only the speaker and the staff here at eLotus, only we can see your comments if you don't actively change it to everyone. So do this right now, change your chat room to everyone, or if you have an older version of Zoom, it's all panelists and attendees. The quiz and also the video replay, both will be available tomorrow afternoon. We do need to take your attendance and all that fun stuff, and then I will personally email you when the quiz and the video recording are ready. All right, so we have 3 groups with us here today. Our first group is our Watch It Free group. You registered for today's class using a coupon code to watch today's class for free. It doesn't include CEUs for you, but you can get CEUs if you upgrade to the second group or the third group. The second group is our paid attendees. Paid attendees, you have access to the class today, as well as the video recording for a month, and the quiz, which you also have a month to complete and get CEUs for. And our third group is our ultimate group, our Gold Pass members. Gold Pass members have access to all of our English courses online, and you can join our webinars or any of our distant learning courses. So for today's class, for example, not only do you have access to the live class and to the quiz, but also the video recording for as long as you are a Gold Pass member. All right, so how many of you are new to auricular diagnosis or auricular acupuncture? If so, type yes into the chat room. Today's webinar is Quick and Easy System for Learning Auricular Diagnosis with Tina Chen. In this course, you'll learn how to use simple visual observation to gain a clear understanding of a patient's past, present, and future conditions. It is really useful for telemedicine and in health fairs when you want to recruit new patients to look at their ears and tell them what's going on. It really amazes the patients, and they immediately have more confidence in you and want to learn more about TCM and how you can help them. Today, Tina will show a simple system for remembering body locations on the ear, as well as detecting and explaining the most commonly observed ear abnormalities. The information presented in this class is a summary of Dr. Li-Chun Huang's and Jimmy Chang's clinical observation, and it serves as an introduction to the 2 masters systems, as well as how to use it in your clinic for diagnosis and patient confidence. Many of you may not know, but Dr. Li-Chun Huang passed away in 2021, and this class is a tribute to her lifetime achievement and contribution to TCM. Let's get started with today's webinar, and welcome Tina Chen.
Hi, everybody. Can everybody hear me? Let's do a quick sound check. Please type yes if you can hear me into the chat room. All right. Well, first, it's so good to see so many old friends online. You know, I don't see you guys, but just seeing your name makes me happy. You know, I've been in the industry for a long time, maybe 20 years, some 20 years, maybe or more. I can't remember, lost count. And some of you I have known since the very beginning when I got into the profession. So a little quick introduction of myself. My name is Tina Chen, and most of you probably know my brother more, John Chen, right? He's the one that wrote the book. Actually, we wrote it together. And also he did quite a few seminars last year, actually all along, you know, since we have been in the profession, and also a lot of classes last year on COVID. So you probably know. That is my brother, not my husband, by the way. Okay, so a little background, all right, and how of who I am and how I got into the medicine. So when we were little, I moved to the United States when I was 12. And when we moved over, we didn't even know anything about Chinese medicine. My dad, my family were all very Western medicine oriented. And maybe about 2 years after I moved here, on my mom's side, I had three uncles, and all three of them had hepatitis and then developed into cirrhosis and developed into liver cancer all the same year. So as you can imagine, everyone is frantic to try to find some solution or some cure for the liver cancer. So that was when my dad was had the responsibility of looking for Chinese medicine solutions. So at the time, he didn't know anything about TCM because back home when we were in Taiwan, he used to build houses. He knows nothing about it. And then after researching more about for half a year, he found that this is like a great philosophy and great medicine and great profession. So he introduced my uncles to start Chinese medicine treatment. But unfortunately, they still all passed away because I think the treatment started a little too late. And also we didn't know too much and we didn't know too many good doctors. But as a result, my dad decided to study Chinese medicine as from this occurrence. So he enrolled himself into Chinese medicine school. And after 1 quarter, he came home and he told my two brothers to go study Chinese medicine too. He said, "Oh, why don't you guys study? I will pay for it. It's a good philosophy, good knowledge to know. And if you don't later on end up practicing, that's okay. It's something that is going to be with you that you can help yourself, help your friends and your family." So my two brothers, I have John as a brother and another one, older one. I don't think most of you know, he is an attorney. He also went to study Chinese medicine. So my dad got them to study Chinese medicine. And a couple quarters later, I remember him coming up to me, and I was after school, after high school. I was 15, I remember. I was watching Tom and Jerry at the time after school. And then he approached me. He said, "Hey, Tina, do you want to go to Chinese medicine school?" And I said, "What? Dad, I don't even drive." And then he said, "I will take you. No, I'll pick you up too." So then I was 15. I didn't know. I said, "Okay, sure. Why not?" My brothers all went. So I went. So I remember, gosh, that was in the, I don't know, 80s. Yeah, in the 80s. Yeah. We had 3 students in each class, 2 sometimes in some classes. And the only reason I was able to go to school was because I spoke Chinese. And back then there were only one book in English. That was the Shanghai Essentials book. Everything else was in Chinese. And the teachers were Chinese and speak much English. So I acted as a translator most of the time. So then the principal said, "Okay, yeah, your daughter can attend, she can help too." And so that was that. My daytime was going to high school, nighttime was going to acupuncture school. It was very different because at daytime you're, giggling with the girls, and at night you're hearing, wow, these people are talking about their jobs, their family, and it's so different. Anyway, so that was a little bit of my childhood. So then when I graduated from Chinese medicine school, John also graduated before me. So he got his license at 18, and then I got my license, I don't know, maybe around 20, something like that. So then what are you going to do after you get your license? Naturally, you would practice, right? So I started to practice with my father in LA. And what happened was, I don't know if you know about the Chinese community, but he mostly saw Chinese patients. And when Chinese patients come, they want to see the old doctor. Me too, actually. So all these patients would come in, they would ask, "Hey, where's your dad? We want to see your dad." And I would have no patience. Some of them would ask, "Do you do massage, or do something else?" No. So pretty soon I decided, oh, maybe I shouldn't practice yet. I just am too young, I don't have any experience. So there was an opportunity to distribute herbs from a vendor in Taiwan. So that's how we got started. We decided, okay, well, if we want to stay in the industry, we don't want to practice, what should we do? So this opportunity came up, and then John and I then decided, okay, well, let's sell some herbs then, let's see if we can do this. And so that's what we did. In the 90s, we started the Lotus Herbs Company, and it eventually evolved into Evergreen. And then during this process, I met a lot of doctors because my dad sent me to China, study in different provinces, in different hospitals with different teachers, and then later went to Taiwan. So I met a good share of really good doctors. There are some doctors that were really good teachers that I resonated with. They wanted to teach me, I thought they were good. Um, so during this time, we encountered, I remember the first seminar that we ever had was with a doctor from Tianjin. He specialized in geriatric diseases. He had a family formula that treated Alzheimer's. That was a wonderful formula. So he gave a lecture and then he taught, and then there were other speakers who came. One speaker that came, she did nothing but moxa and auricular medicine. And this is off topic, but I will just tell you what happened with this doctor and what I learned from her. She came for half a year. She came to speak for a Chinese association, and she did moxa. So in the clinic, she was treating the patients with moxa. I was treating the same patients with the same moxa. But what was so funny was she was getting results and I wasn't getting results. I always wonder why, the variables are the same. I couldn't understand. So after half a year went by, she was gonna go back to China, and she said, Tina, she sat me down and she said, Tina, I will tell you why yours doesn't work. Your treatment doesn't work and mine works because I'm going back to China now. So that means, I'm no competition. So then she said, the secret is just time. You see me moxing the patient for half an hour to 40 minutes, chatting with them. I am not really just chatting with them. With moxa, it just takes time. And you are there doing it for 15 minutes. That's why you don't see the results. And I thought, wow, I thought she was just a very talkative lady, but no, she just had to talk. What are you going to do in the room with the patient, right? If you're there for that long, you talk to them. So then that was when I thought, wow, if she didn't tell me that, I would never know. And then she just told me that because she was leaving. So this is just to tell you that Chinese teachers are really, most of the Chinese teachers are really very, very hard to learn from. That's my experience. I don't know if you've had other experience, because the culture is different. They expect the teacher disciple relationship very different than nowadays, where you pay for a class and you just go learn and expect the teacher to teach everything. But no, that is usually not the case. Some teachers are very traditional, so not a lot of them would like to lecture, but there are some that would like to speak, and we would invite them to speak, and I would go to their clinic and learn from them. So the thing is, it's just very difficult to find good teachers because, if you see doctors who are very good in their clinic, they produce results, but sometimes they're just not very good speakers. They cannot articulate the why, or they cannot tell you, or they don't want to tell you. I don't know what it is. So it's very hard to find somebody who is good in the clinic and also willing to teach and can teach it, in a way that is easily understandable and also kind of exciting too. So I think Dr. Tan is one of the best at that. His classes are always very entertaining and, and very informative. So anyway, so today's class is dedicated to Dr. Li-Chun Huang. She is one of my dear teachers. I met her a long time ago. I don't know, maybe 20 years ago. Again, I can't remember. It's so sad that she passed away last year. I knew she was having some health issues. But if you have learned from her and worked with her, you would know that she is really very dedicated to her art. And I don't know anybody, I haven't learned another method of auricular. I know there are others out there that are as extensive as hers. So I feel like, I should do a little intro class, which is why I'm doing it today, to let more people know about her contribution. Because really, if you have gone through her 8 classes, you will know how brilliant she is. And today's class is just a little intro on when I was learning from her, what kind of problems did I have? What kind of questions did I have? How did I organize my notes so that it's easy to understand? So pretty much the Cliff Notes version, so that you can quickly catch on. Okay, so let's see, next slide. So Dr. Li-Chun Huang, she actually is an MD, and she was studying to be a surgeon. So this is her when she was telling us when she was here recording. She told us that the reason why she didn't go into Western medicine is because as she was studying to be a surgeon, she went on a field trip one time with her fellow, friends who were in class. And then on the way back, she injured her middle finger in the car. I think it got stuck in the back of the truck or when the door slammed on it. I don't know what happened. But basically, she lost some function in the middle finger. So as a result, her teacher told her that you can't be a surgeon anymore because you cannot move your finger and your hand like other people. So what did she do? She was very upset and she was very sad. But her teacher basically told her, when a door opens, maybe another window will open. When a door closes, another window might open. So then they designated her to another department in the hospital. And that was in the TCM department, in the auricular medicine department. So, it's very interesting how life is like that. Maybe if she would have been a surgeon, she would have been an excellent surgeon. But because she hurt her finger, fate has it that she comes into Chinese medicine and, discover all these things that I'm going to teach you and more, and enrich the, the knowledge base for tomorrow's practitioner. So when she was younger, she said that she treated so many patients, like maybe 300 patients a day. She had 3 assistants there, all there to help her tape the ears and, help her prepare. So all she had to do was quickly diagnose and then tell them where to place the seeds. And because she was very famous, she was selected as one of the top 100 doctors of today. If you understand Chinese, there is a video interview of these doctors, these modern day good doctors, 100 of them. You can see the videos of her biography and also her lifetime work. And then also she is the only practitioner I know who treated 3 presidents. Out of all the teachers I learned from and people that I know, if you treat 1 president, it's already pretty good. She treated 3, Cuban, Italian, and the Chinese. And this in the slide that you see here, this medal here, is when she said that the Italian president went to visit China. And then I think he had headache or something. I forgot if it was a headache or something else. So then he couldn't attend the next day's meeting. So the government sent 3 doctors to go treat him. Dr. Huang was one of them. And she was able to treat him. I think it was headache. So she was able to take the headache away. And, he was very amazed at the effect and very happy. So he gave her this silver coin here. I thought that was very interesting. It's like her special pass that she could always go into the Italian government as a special guest anytime she wanted. So that was a pretty interesting little story. I thought, wow, she is really very good. Okay, so then we had a class with her maybe some 20 years ago. Just 1 weekend class. And after that, she spoke everywhere. She is a prolific writer and also speaker. She was, I think, Portugal, in Europe. She lectured a lot in South America. So in 2004, she was 77 and she decided that she was getting old and she decided that she has to pass down her knowledge to somebody. And she worked with a lot of people, a lot of organizations, and she decided to pick us. So we were very honored that she wanted to record her lifetime teachings because, she was very worried about piracy and, people copying, because being Chinese, that's sort of like the nature, if you upload anything, it's just going to be copied. So she decided to do that. And she came over and she lectured with us. And she did her 8 classes. Can you believe it? 128 hours. We were recording every day for 6-7 hours straight, every single day. I can't even remember for how long, over a week long. And I thought, wow, I thought I worked hard, but compared to her, I don't even work enough. So here you see there's Sam to the right and me and then Dr. Huang in the middle. And Donna is there. And to the very side is my cousin, Kevin. Kevin is another family member that my dad convinced to go to Chinese medicine school. And he is a great doctor right now. He studied from this very famous doctor in Taiwan, very, very brilliant, Dr. called Li-Chun, if you guys know. He specializes in not 推拿, but manipulation. So, and also acupuncture. So Kevin is there. Kevin helped translate Dr. Huang's lecture from Chinese to English. He did the first draft. Another friend of mine, Thomas Chow, thank you to him. He translated he looked over Kevin's work and did the second draft. And I looked over the third and I did the voiceover and also the editing. So the translation took hundreds and hundreds of hours, but I think it's worth it because her material is just brilliant, as you will see a little bit later, okay? So here in this picture, you see this is Lu Yao, this is Ruth, this is her daughter-in-law. Unfortunately, Dr. Huang's son didn't go into Chinese medicine, so the daughter-in-law, however, did. And also the granddaughter is also in medicine. So they're passing down the knowledge from generation to generation. And this was the class, some of the class members, Dr. Huang lecturing. And then, you know, we were learning, Donna's learning how to massage the ear, how to place the seeds on the ear. And then this picture is, I took a picture of her when we went to lunch because every day we were going to the same restaurant. This was her favorite dish, the large intestine. Every day she wanted to eat this same dish. It's really funny. Even after she went back to Alabama, she would call me sometimes and say, hey, I missed the large intestine. Can you mail me some? Very cute lady. Okay, so that is a little bit of introduction. And let me go over what we're going to talk about today, okay? Okay, so today what I want to just teach you is just the most important basics and the locations of her system. It's really very easy, you know. Once you go through today's 2 hour, tomorrow, I am sure you will be able to find something wrong with your patient just by looking at the ear. I am positive because the system is just that easy. So towards the end of the class today, I'll mention Dr. Jimmy Chang and his auricular diagnosis as opposed to Dr. Huang's. They're slightly different because I introduced Dr. Huang's system to Dr. Jimmy Chang, my other teacher. I don't know, I can't remember how long ago. And then, so since then, he has discovered some new diagnosis from there. So I will go over those. So for those of you who are studying Jimmy's system, you can understand the difference and also have a much easier time memorizing all the points. Okay, so I want to let you know that nothing I'm presenting today is original to me. Everything is their clinical discoveries, okay? I am just a channel to pass on the knowledge to you. I feel like there's endless learning. I have so many teachers. Everything I learn just kind of comes in and goes out. Some retains in my brain, some don't. But whatever I remember, I organize it in an easy fashion today for you to understand. Okay, so today's 2 hour class is the Cliff Notes version. It's only about 5% of Dr. Huang's knowledge. So if you want to learn more, you got to watch her class because I don't know enough, really, honestly, to teach you the depth of what she knows. And it's not fair to say, after you watch this 2 hours, to say, oh, that is it about auricular medicine. Not at all. Okay, so now, I don't know about you guys. Where did you learn Chinese medicine? I mean, not Chinese medicine, auricular medicine. I learned it first in acupuncture school. It was a 3 hour class only. That's it. It was, I think, acupuncture 3. And then they taught us about scalp acupuncture, auricular, and then I can't remember what else. But I just remember that auricular acupuncture was only 3 hours. And we learned that, oh, Tzone is a good point to use. You have to use that if patient have Chen disturbance or have anemia. And then, yeah, that's pretty much it. I don't remember anything else from that class, that 3 hour class. Maybe, you know, the teacher went over some of those points, but that's about it. I only remember Tzone. So I don't know what you learned. If you can put in the chat room, that would be interesting for me to know because after that class, I thought, I know auricular acupuncture is just Tzone, so there's just like one more point. You know, why do we need to study the ear? But that idea was completely broken when I saw Dr. Huang 10 years ago in class for a full 2 days because she went over how to treat pain. And she also demoed how to treat pain, how to diagnose a patient with pain. She was able to tell exactly on what knee, on the lateral side or the medial side, which side of the knee hurts and exactly where. And I thought, wow, no way, that's pretty good. And then when she did the demo and she bled the patient and treated the back pain, the pain was gone just like that. It was just as fast as acupuncture, body acupuncture. So I thought, wow, I didn't know ear acupuncture could do this. That was when my interest was sparked. Okay, so next slide. Now, gosh, there are so many points, right? So many points scattered everywhere. Now, how do you memorize these points? That's the first question. Do you just kind of don't memorize them and look at the chart, and then whenever a patient has a problem, refer to your chart, or is there a system? So there are also many different systems of auricular acupuncture, right? There's the French system, there's the traditional Chinese government communist PPRC system, and there's the Dr. Huang system. That's the system I learned. Which one should you follow and which one's right? I would say they're all correct because, it's a micro system. It's kind of like Dr. Tan's imaging, right? There's imaging, there's reverse imaging. People are discovering new points on the ear. So I would say, I don't think, I wouldn't know if anything is wrong, but I would say that there's more to Dr. Huang's system for sure. So for those of you who learn like a different system, if you can also teach me and teach everybody else in class too, in the chat room, whenever I talk about something, if it's different than what you learn, if you can put it in, I think that would be a lot more interactive and people can pick up more information too. Okay, so let's next page. So in order to study this auricular medicine, all right, to break it down to bigger pictures, it's very easy, but you have to grasp these three important concepts. One is you need to know the anatomy of the ear, because it's hard to communicate with peers when you're just saying that point right there, below the protrusion, right there, that where's right there. So you need to know the anatomy. And there's not too many to know, maybe 10 different anatomical names to remember. And then two is to remember the systems. This is actually the secret to memorizing the points. There's so many points, hundreds of points. And if you just memorize them one by one, you'll quickly forget. But Dr. Huang is so brilliant because when you learn her class, she'll go over the different areas of the ear and then what points are in those ears. And then when you get to the class 6, I think, the diagnosis class, 5 or 6, when she goes over the electrical detection, she has these routes that she tests on the ear. And I'm going to show you that in a second. And these routes are the different systems in the body. So if you don't remember the points, but just remember the systems and where they are, then you will easily remember because it's very logical how the flow of the anatomy goes. Okay, so that's the second. You need to remember the imaging of the systems. Don't remember the points, remember the systems and where they are on the ear. And number 3 is you need to know what you're looking for, right? What exactly am I looking for on the ear to tell me what's wrong with the patient? So what are we looking for, the manifestation, and what does it mean? So I'll go over all of that too. So it's a very visual class. I feel like I don't really have to say too much to describe anything because it's really, a picture is worth 1,000 words. And when I was studying with Dr. Huang, back then there was no, iPhone or smartphone to take pictures. So she took a long time to collect a lot of photos, using her regular old camera and to present the class, but nowadays I have so many ear pictures. I have them ready to show you if we finish early, show you a lot of pictures of ears and we can go over them together. But I think it's really easy that you can see people's ear anywhere, your patients, or even when you're in the grocery store waiting in line to check out, you can look at the person's ear in front of you and look at to see what's wrong with them. I do that all the time. It's just interesting to look. Okay, so let's go to the next slide. All right, let's get right into it. All right. The anatomy of the ear. So this picture on your lecture notes is half a page. Donna helped me put this to a full page. So on your blue course access page for the class today, you know, where you click to enter today's class, there is this lecture notes for the PowerPoint, and there should also be another additional notes. So in there, you will find this picture, full size. You can print that out if you like, 8.5 by 11 size to see it more clearly. So pretty much, I think you can read this yourself. I don't have to read this to you, you know, this is just where everything is. So later on, when I'm describing certain manifestations or whatever to look for on the ear, I will refer to these anatomy. And if you don't know them, it's okay. I will be pointing to them anyway. I will be drawing, you know, on the ear, so you will see where exactly I'm talking about. Thank goodness for technology today. Makes things so much simpler. Okay. Next is we're gonna talk about the imaging by systems. Now this is where you should memorize where is what. Instead of memorizing the points, again, memorize them by the systems, okay? And where the lines are. And before you memorize that, I want you to remember this picture. Dr. Nogier first proposed that the ear is an inverted embryo. So if you just remember that, you've already remembered 50% of the points, because the earlobe is pretty much everything on the head. The upper jaw and the middle jaw is in the cavity. Okay, let me draw it now. Annotate. Upper and middle jaw here in the cavern concha. I mean, sorry, upper and middle jaw here, and then lower jaw here in the Simba. Okay, let me go back one slide. And then the toe is at the bottom, the arm is on the side. So if you just remember the inverted fetus, you can pretty much at least tell upper body from lower body on the ear where it is. So that's better than nothing, okay? So let's go to the next slide. Okay, here we're gonna spend a little more time here on this slide here. Okay, so to the right, you see this picture of an ear with a lot of different lines and different colors and numbers, right? This one is also on the additional notes section. Donna also put that in so you can see it bigger. But pretty much follow me here, all right? Let's go over them one by one because this part is a little more important. So the first system is the cardiovascular and the respiratory system. So that would be this one right here. So if you just remember in this cavity, you have the cardiovascular and the respiratory. That is enough. Don't remember any of the point. Bronchus, you know, trachea, heart. Don't remember any of that. Just remember the two systems, cardiovascular and respiratory. Second, you have the digestive and the abdomen. And that is right here, number 2. This one right here. So this little U shape here in the middle of the ear, that's your number 2. So the whole digestive tract just is covered along this area. That's it. Starting from the esophagus, you will see later, starting from the mouth, esophagus, stomach, and all the way down to the anus. It just follows this pattern, the U pattern, right along the center of the ear. Number 3, everything about the liver and gallbladder you will find in this T right here. Number 3, this T here is the hepatic system. All right. Number 4, the spine. Here is the antihelix, the spine, number 4. So if you take a landmark, basically from right here to end right here, where the triangular fossa starts, you divide this whole line into 5 sections. Then you have your entire spine. Okay, so the first section of the 5 is the cervical. Second and the third, right here. Oh, you know what? Sam, show me you can use spotlight. Yeah, let's see if that works. Oh, no. How about this? Okay, so the second and the third here, these 2 sections are the thoracic spine. And then the 4th section, this is your lumbar. the lumbar right here. And the last section here, is the sacrum. So it's very logically arranged anatomically, right? So you're going from cervical to thoracic to lumbar, and then all the way to sacrum. And all along there, that's the spine. If you see any abnormalities on that line, something's wrong with the spine. It's just that easy, really. Trust me. So let's keep going, okay? Number 5 is the reproductive system. Okay, let me clear this out. So reproductive system is number 5, which is this whole triangular fossa. That's just all the reproductive system. And let me remind you, there are, of course, exceptions to this, okay? This system particularly, because the ovary is not in there, ovary is somewhere else. So, but rest of the reproductive system is there. So the whole triangular fossa is a reproductive system. Number 6, urinary, is this green line here, starting from the edge here, inside the ear, you go along and then to the helix and up. That is your urinary system, the L shape. Number 7, the upper extremity is in the scapha. That is the upper extremity. So here you have the shoulder, and then you have the elbow, the wrist, and fingers. So that is this whole scapha area. That's your upper extremity, your arm. And number 8, you have the lower extremity. Lower extremity is this right here. Right here. This is the lower extremity. The sigma, can you see? The sigma number 8, that's the lower extremity. So here you have the hip, you have your knees, you have your ankle, you have your heel, you have your sole and your toes. That's all number 8. Number 9, you have the face. So anything wrong with the earlobe, you know you're looking at the face. Either the eyes, the tonsils, the jaw, all on the face. There are 9 sections there. So we will go over those too. So pretty much everything on the face is there. And then number 10 is the head and brain. The head and brain is right here, number 10, the antitragus. The outside and the inside, both are the brain. Okay, the cortexes, the brain is actually on the inside of the antitragus. So is that pretty clear? I highlighted the major lines, which are the major systems. She grouped them together like this for easier memorization. And it is really much easier than memorizing them point by point. Okay, do you have any questions so far on this? Questions, you can type into the question and answer, and then I'll look at them, and then if there's anything, I'll answer them. Okay, no questions, it's pretty clear. I think it's pretty clear. Is it easy to understand? All right, let's go to the next slide. Okay, so here I laid out what points are in each of these lines, each of these low areas. So then you can know, what to look for and where exactly is it. Zoom in to her ear chart. Okay, can you look at the additional notes? There should be a page of this in black and white. This is Dr. Huang's chart. So here you can see the whole ear with where all the points are. So you can print them out or open them on your computer. You can minimize zoom and look at this if you need to check certain points. But I pretty much put them here according to the systems and also which organs are included in that system that is in that line or in that area. Okay, so the first one is the heart. You have the heart right here in the middle, in the cavern concha, above the respiratory system. So she did this in like a dipper shape because in her palpation diagnosis class, that's how she palpates to see if there's anything wrong with the heart and also with the lung. She uses a probe, and then she would check it in this shape just to see if there are any cords. And cord, what is a cord? I will tell you that a little later too. So this is the shape that she goes to check to see if there are any cords, protrusions, edemas, or any kind of pain sensation. So right here in the center is where you find the heart. Okay. Next, the respiratory system. Now take a look. You have the lung. So you have the lung right here, and you have the tragus, bronchus, TB point is all in this little dipper here. Okay, and pretty much there's the external nose and the internal nose right here at the tragus. So that's just your respiratory system. It is in that general area. So what I want you to remember today is not to remember any of these specific points, but just to remember, okay, the respiratory system organs are here in this area, and that is enough. Just grasp the big picture first, because you can always go back to your chart and look at the specific location. And to be honest with you, after studying with her and also, practicing and looking at patients and looking back at her notes, sometimes the points of what she says is the diagnosis is not exactly what I think is that point specifically on the year if you match it. But I think it's because, for example, if there's a swelling on the ear, a red swelling, it could be a little swelling, a little dot, or it could be really big. So it might be covering several different anatomy parts. So for her and her experience, it's something else than what I think it is. So we might come up with a few of those pictures in a bit, and so you can take a look. So now the digestive system and the abdomen. Okay, so starting here, let me get my annotate again. Okay, so starting from here, you have the mouth. So then you go down the mouth, esophagus, cardia, right? So it just follows this pattern: mouth, esophagus, cardia, and then you have the stomach, right? Cardia is where the sphincter is. And then you have the stomach, and then after that it's the duodenum, and then you have the small intestine, you have the sigmoid, large intestine, and the rectum, and then anus is a little higher up. So pretty much that's the digestive system. I don't know how much easier it can get than this. So I was so thankful when she laid this out like this. There's a lot less memorization. So if you see any kind of abnormality on any of these points, that's what it means. So for a lot of patients, you will see problem here because there are a lot of people with epigastric pain. A lot of time is due to a duodenal problem. So if you see like a little red dot, that is an ulcer in the duodenum. If you see this area to be white and swelled up, that is also a duodenal problem, but it's not an ulcer, it's some sort of inflammation. And if you see that kind of swelling here in the stomach, it's like a gastritis. But you don't need to know exactly what the diagnosis is. This is a beginner's class. If this is new to you, all you need to know is, oh, there's something wrong with the stomach. Okay, let's go to the next slide. Okay, so let's go to the T-zone. So the T-zone is right here, number 3, right? So on the ear, we have the right ear and the left ear. The T-zone is the liver on the right ear and spleen on the left ear, right? That's anatomical, right? So on the right side, you're gonna find the liver and the gallbladder, the bile duct. And then you will find the hepatomegaly point too when it swells up. And on the left, you have the spleen, you have the splenomegaly, and you have the blood point. I didn't put it in. Pancreas is also on the left. So on the ear, this is very Western medicine, I feel. The anatomy of the ear is just reflecting the anatomy of your organ. Whatever is on the right side of the body is going to be on the right ear. Whatever is on the left side of the body will be on the left ear. Okay, is that pretty clear? And then here I put down T-zone, you have to lift the ear. Meaning, here's a little ear. Can you see this, Sam? You can zoom in. Let me show you what she means when she says you have to lift the ear. So if you just look at a regular ear, you know, and then it's laying flat like this, you know, patient sitting in front of you, you can't see. You have to take this, part of the ear and then lift it like this. So then you expose this area, which is the inside, right? Sometimes when you're looking at the patient from this angle, you can't see what's up here, like what's in here, right? You can't see that angle. And you can really, what you can do is get down in an angle to look at that point, or you can just lift the ear and then you will see any kind of cartilage protrusion or whatever abnormality to show you if there is any kind of pathology going on. You know, enlargement of the liver is going to show like that. Gallstone is going to show like that. When you lift the ear, you will see some protrusion there. I'll show you some pictures later. Okay, let's go to the next slide. The spine. Okay, so the spine is right here. Right? We start from here, right? This is the C1. And here's the coccyx, you see? So we're dividing into 1, 2, 3, 4, 5. So 1, 2, 3, 4, 5. So cervical, right? Thoracic, 2 and 3. Lumbar, 4 and 5. So memorize this, okay? This is divided into 5 sections. You will see a lot of this because we are treating a lot of pain in our clinic. Back pain. Tomorrow, if you have any back pain patient, go check this lumbar area. See if there's any problem. What are you checking for? I'll tell you in a bit. But that is the area to check if you want to check for back pain. Now, right along the protrusion of the ear, you know, the antihelix is the spine, the actual bone. On the side here are the muscles, the paraspinal muscles running along the side of the spine. Those muscles are on the side. So the muscles here, these are the muscles running along the cervical, the thoracic, the lumbar, right? In the buttock area. And then the actual spine is this right here, the protrusion. Okay, is that clear? Okay, so next page. Oops. Close. Okay, so reproductive organ in the triangular fossa, you can find is dotted with all the different reproductive organ. And then the ovaries are not there. Ovaries are down at the antitragus. Well, I will show you some pictures later. So you can just go home, take a look at, and then, you know, try to figure out some pattern here. But for me, the triangular fossa, I just remember the uterus point more than anything else, this uterus point, because there could be a lot of problems there more than other places. So that's the point that I like to remember more. Next, number 6, urinary. Urinary, we're going from here, kidney. So where you see this little curve here, starting from the kidney, you have the ureter, bladder, prostate, urethra, and then going out. So it's pretty much right all along this line is the urinary system, kidney and urinary system. And this is also a system where you have to lift up the ear a bit to see because you're looking at the inside of the ear. So here, you know, when you're looking at it straight, you may not be able to see the inside, but if you lift it up, you can see it much easier. Okay. Clear. Number 7. Number 7, the scapha. So we have starting the shoulder right here. Shoulder joint. Can you guys see, is this a good color? think this is a better color. Oh, this color. Shoulder joint, shoulder, and then elbow, wrist, and then fingers. So easy. That's just pretty much the arm. So if you see any redness, any vessels, or anything wrong in that area, you know something is wrong with the arm. Either that tennis elbow, carpal tunnel, frozen shoulder, or whatever. They will all show there. Okay, next slide. Number 8, the lower body. Lower body is this sigma shape. So it starts from the external knee, goes like this, like this. I didn't put them in order, but it should be like this, starting from the knee, hip, knee joint, ankle, sole, and then the toes. Okay, let's go to the next slide, the face. Okay, so face, Dr. Huang separated into 9 areas just to make it easier to locate the points. So what you're looking at is from here where the antitragus is, she draws a line across. That is this entire area at your earlobe, right? So one line across and divide that into 9 sections. So this is area 1, 2, 3, 4, 5, 6, 7, 8, 9. Yeah, so then you will find, specific body imaging parts on those 9 areas. Okay, so let's go to the next slide. This is 4, 5, 6, 7, 8. Okay, the head. The head is right here. So head is in this general area on the inside and the outside. So you have the brainstem, the dizziness area, occiput, vertex. So a lot of patients, if you coming to you for headache, you will see protrusion right here. So if you can't tell where's what, just remember if you see a protrusion there, they have headache. Exactly where's the headache is when you get a little more advanced. If you want to take your chart and match it to the patient's ear. Okay, if the protrusion is here, that would be a vertex headache. If it's higher up, it's an occipital headache, right? If it's towards the front more, it's a frontal headache. I find that if I can tell them they have a headache already, they are very impressed. And then there in my head, I'm thinking, gosh, I can't even tell the difference. Is it a frontal headache or a temporal headache? But then the patient is already, think you're God, but not at all. Anyway, let's go to the next slide. So the brain. If you look at this chart in your additional notes, for the longest time, maybe after the 3rd class, I didn't know what this little piece was until maybe after the class was over. I think Donna figured it out. She's smarter. This little piece is this area, the antitragus, when it's pulled down. So I'm going to show you on my ear. Somebody requested that. Can you zoom into my ear? I think it's easier. Or show it on Donna's ear. Maybe on Donna's ear, yeah. Okay, we're gonna we'll go to the. We'll just come to the front here. Oh, Sam, you don't have to do anything. She's just gonna be in front. Oh, can you go in front of the camera? You're too tall. Go down a little. Okay. Let me get my pen. No, it's okay. That's fine. Yeah. So that little part that you see is pretty much this pull down, is this area right here. I'm not drawing on you, okay? So this area. So if you pull your ear down, that's this area. That is all the subcortexes and all the brain. One more time. Okay, so in that chart is in your additional notes. In your additional notes section is the ear pulled down like this area inside. Okay, got it? And then earlier when I was talking about the gallbladder and the hepatic section, that's over here. So you can't really see, right? If you're just looking at it like this with the ear in its natural position. But if you pull the ear out like this, you can see, you can expose the area and see it much more clearly. Also the kidney too. Kidney is in here and you can't see that. You have to lift it like this and then trace it with the probe all along here inside to get to the urethra, right? Kidney, ureter, bladder, urethra. So you have to pull the ear up, pull the ear 45 degrees to check the liver and the spleen, and then this way to see the kidney, and then pull it down this way to see the inside of the brain. Okay, thank you. Okay, so that summarizes this section. Is really easy. When you go home, remember these 10 areas, then you'll remember the 10 systems. Then you'll have a good idea where all the points are. Then always just go back to refer to your notes. I gave you the black and white version because, you know, for notes purposes. Dr. Huang has a laminated version that is, you know, it's got the natural color of the meat and also like shadow, so you can see a little better. And then there is one of the right ear and one of the left ear. I recommend you getting both because when you're just starting to study, it makes so much sense when you look at one ear, but something happens to the brain when you have to take this point and then cross it over to the other ear. You, at least mine gets confused. Oh, where was that? You know, where's the reference point? So I just find it easier to have 2 ears. And I tape these on my wall where my consultation table is. So when I'm looking at the patient's ear, I'm looking at the wall too, you know, to verify what point it is. And the more you do this, the more it'll just become second nature to you. It's just gonna, you're just gonna remember the points. And these ones that I circle are just the ones that are gonna have electrical resistance when you beep, when you're doing the beeping the machine. Those are the points that naturally would sound. So don't worry about that. That's nothing. But there's also, I forgot to say, there's the back of the ear. There are also some points too, but we're not going to go over those. Let's just get the big picture first. Okay, so remember those systems. Okay, so I just said that they are more points. There are also points, more points listed than the ones above. Okay, memorize the big picture, put the chart next to you. And there are always exceptions like the ovary point. There are points on the back of the ear. So it's very straightforward. The points on the back of the ear are the points on the back of your body. So when you're treating back pain, she not only see the, you know, tape seeds on the front of the ear, she also tapes them on the back of the ear to treat the back. So if you're treating shoulder pain, the shoulder pain is in the front, you would tape the front of the ear. If the shoulder pain is in the back, you would tape the back of the shoulder. And when in doubt, or if it's very painful, just tape both because that just makes the treatment that much stronger. So when patient squeezes the point, they're stimulating from the front and the back. Okay, so one more thing, the ipsilateral relationship, okay? The left ear points refer to organs on the left side of the body. The right refers to the right. I went over that a little bit. So when you get like both of these charts from Dr. Ruth, you will see that on the left side of the ear, you will find pancreas, heart, you know, blood disorder, spleen. Oh, I missed that. On the left, I missed spleen. Can you put that in yourself? And on the right, you have the liver, the bile duct, right, gallbladder. So that's just anatomy. If you know where it is, then you know it is on that ear, but you just don't know where exactly on the ear, but you can always refer back to the chart. This slide is to tell you it's an ipsilateral relationship. Now then the next question is, okay, so if the organ appears on both ears, what does that mean? So you have the lung that's on both ears, right? What does that mean? You know? You want to put it in the chat room if you know? So does that mean the 2 lungs are over here on the right and the 2 lungs are over here on the left? Or is it the right lung is on the right ear, the left lung is on the left ear? What do you think? So the answer is the right lung is on the right ear, the left lung is on the left ear. If you're dealing with lung cancer and you only see it on the right lung point, that means the cancer is on the right side of the lung. Okay. Oh, going back. How about treatment? Treatment is the same thing. If the problem is on the right side, you would treat the right side. You would not treat the left. You don't need to. There's no problem on the left. Now, question for you. Next question. What about the organs that are in the middle? I asked her that question. I remember. Oh, how about the heart, Dr. Huang? Dr. Huang, the heart is in the middle. We don't have an ear in the middle of the face. She said, oh, the heart is on both ears. Same thing. The heart, the right side of the heart is on the right ear. Left side of the heart is on the left ear. But predominantly, she uses the left ear to diagnose heart problems because anatomically, the heart is more on the left side than on the right side, although it's sort of in the center, right? And then the next question is, how about the uterus and the stomach? So the idea is the same. You know, the right side of the stomach is on the right ear, left on the left. Right side of the uterus on the right ear, left side of the uterus on the left ear. If you have a fibroid on the left side of the uterus, you will see it on this ear. You will not see it on this ear. Very simple, right? Okay, so question. Are these auricular points both for diagnosis and treatment or just for diagnosis? The answer is it's both for diagnosis and treatment. It's a wonderful system because if you think about it, is there another system like that? I'm not sure because you have the imaging system, right, from Dr. Tan. You can diagnose, I suppose you could treat too at whatever the painful point is, but it's not exactly like that. The hand therapy, Korean hand therapy, you know, naval acupuncture. But this system is really spectacular for diagnosing right on the ear. And then wherever the problem is, you treat right on the ear too. Okay, so let me ask you a question. Which side would you detect, which ear would you check to detect the appendix or appendicitis problem? Right, very good. Yeah, right side. If you want to treat the appendix, would you treat the right ear or would you treat the left ear? Yeah, right ear. This is so easy, right? Okay, so now next question. The knee is on both sides. If the redness appears on the right ear but not on the left, what does that mean? If there's redness is inflammation. So that means there is a inflammation and pain on the right knee. That's what that means. Left knee is fine. I see Sam nodding his head. He's our barefoot doctor. He's been to every seminar. Okay, now uterus is on both ears. If a bump appears on the right and not the left, what does that mean? So same thing. If there's a bump, most likely there's a fibroid or some sort of mass growing on the right side. So it's on the right side of the uterus. That's what that means. And when you treat, you just tape the right side of the uterus. Tape directly on that spot. Okay, so pay attention now, okay? Well, it's not part of the class, but I'll tell you anyways. The treatment, when you take the seed, she does not just use one point. Let me repeat. She does not use just one ear seed, one point. She uses 2 to 4, sometimes 6 seeds to cover the entire area of the problem. That, I think, makes her treatment that much more effective. Okay, so write that down. Very important. Enough stimulation, kind of like Master Dong's Daoma, right? You use 3 needles instead of just 1. Why does he use such a thick gauge needle? Sometimes I think, you know, Chinese style and Japanese style is so different, acupuncture wise and everything else. Everything Chinese style is so like strong. Okay, next one. Now, when you're treating an organ or a systemic problem versus treating problem with the limbs or specific size, do you treat both sides or just the affected side? So that means, okay, if I am treating, I don't know, diarrhea, okay, problem with the large intestine, do I treat both sides or does just treat one side? Because if you're treating diarrhea, which side is affected, kind of like both sides. So you would treat both sides. That's a systemic problem. If you're treating an organ, you would also treat both sides. It's stronger that way. However, if you're treating just a limb problem, like a specific elbow, tennis elbow, you just need to treat one side, whatever the side of the problem. But when in doubt, just treat both sides. Okay, so the next section is on auricular diagnosis. We're gonna talk about what are we actually going to look for. Okay, so let's take a break and then come back. I'll go into specifically what are we looking for, what does it mean, and show you a bunch of pictures. Okay, let's take a 10 minutes break.
Welcome back from break, everyone. With more practitioners implementing telemedicine and using more herbal medicine in their practice, there's a need for some pointers on modern uses, research, and applications. This is the start of something great for herbal medicine because it's the best way to help your patients remotely and earn an alternative form of income. The clinical manual has been said to be the best guidebook of what formulas to use for specific disorders, what points, TCM and Master Dome, auricular points, dietary and lifestyle recommendations, herb drug interactions, lab results, and so much more. This book is a collaboration of the top TCM practitioners in our industry, including Drs. Richard Tan, Jimmy Chang, Chang Wang, LiChun Huang, John Chen, Matt Van Benschkoten, and Cole Magbangwa, just to name a few. There's no need to reinvent the wheel. Most of the herbal formulas are put together by top herbalists like Drs. Jimmy Chang and John Chen's teachers. So it's very difficult to go wrong with the prescription if you follow the manual. So for example, let's talk about stress, everyone's favorite. Everyone has experienced this, and at times it can get out of hand. What herbs would you give someone to calm down? Do you know what point on the ear calms the mind? I hope you do. What about points to use? So let me show you how to use this handbook to save you time on the thinking process so you can jump forward to treating your patient and seeing results. First, you would access the clinical manual online. You go to the symptom disease index to look up the condition. Usually there will be subconditions. So for example, with stress, is it the regular kind? Does it come with insomnia or with depression? This index makes it very simple for you to figure out what herbal formula to use. Your next step is to click on the herb formula. In this example, the herb formula for a severe case of stress is Calm ES. For each herb formula, it comes with an info page, and it tells you the clinical application, what it does in Western terms, what it does in TCM terms, dosage recommendations, ingredients about the formula, cautions and contraindications, clinical notes from the formulator, and everyone's favorite is what points to use for traditional points, balance method, master domes, and auricular medicine. And again, these points were given by experts of each of the acupuncture systems. Nutritional and lifestyle instructions, case studies, as well as pharmacological and clinical research are also part of this herb formula write-up. You can print out this for your patient and give it to them when you give them their herbs so that they can read more about it. They can see the science and the research behind the herbs and other case studies of how long it takes for them to see results. It saves you a lot of time to not have to explain the same things over and over again. The clinical manual is the modern directory of Chinese medicine. It has everything you need to hold your hand through clinical practice, and the rest is up to you. I'll share the link and access information with you here in the chat room. If you have any specific questions, please feel free to email me at info@elotus.org. And as a reminder, everyone here does receive a free digital access. So no matter where you are, you can always access the clinical manual as long as you have internet access. This can be found, the access to the clinical manual can be found on your Blue Course Access page. So make sure to save that link so you will have forever access to it. We hope you'll utilize this to start your journey on becoming a successful herbalist. This is the perfect opportunity if you are looking to start. All right, let's go ahead and get back to the class.
All right, we're back. Can you all hear me? Yes? In the chat, please. Can you hear me? Yeah, good. Okay. Did you go check out your ear during break in the bathroom? Okay, so let's continue. Auricular diagnosis, part 3. Now, when you're diagnosing the ear, what are we exactly diagnosing? Is it Western or TCM? I mean, can you see kidney deficiency, liver qi stagnation, and Dr. Tan's most famous spleen qi deficiency on the ear? No. 99% of what we're looking at on the ear for Dr. Huang's system, we're talking about Western medicine. I say 99 because I can't remember one diagnosis of TCM that, you know, she mentioned on the ear, but I might be wrong. It's 128 hours. I don't quite remember, but most of all is Western medicine diagnosis. Okay. And so this is a microsystem that can both diagnose and treat Western medicine disorders. The next slide. If you are a beginner, you can diagnose, just remember when we were talking about before break, the different systems. So as long as you know what system the patient has certain problems with, that's good enough for beginners. And I would recommend you first to start with the spine on the anti-helix. You know, you can tell something's wrong with the neck, something's wrong with the thoracic, something with the back or sacrum, hip area. That's already very good, much better than what you know yesterday, which is you didn't know, right? So start with the very easy ones, remember the systems, and then step by step, learn more. Now, once you get really advanced like her, you can diagnose all of these. I cannot, she can. Sometimes she still blows me away when I review her notes. Wow, that's that, you know, I didn't know, I forgot. So things like duodenal ulcer, if it's hereditary or not, you can tell. Superficial gastritis, hemorrhoid, neurodermatitis, myocardial ischemia, constipation, cervicitis, insomnia. If the patient has difficulty falling asleep or the patient has difficulty staying asleep, she can tell too. So she is that good. She is that good. Okay, so there are 3. When you take her class, in class 5 and 6, you're gonna be learning these 3, the visual diagnosis, palpation, and electrical. I'm just gonna go over the visual today. I have a lot of pictures to show you. So I won't even need to describe it, okay? Now, what are we looking for exactly? Number 1, big picture, okay? This class is just all about big picture. 1 is you look for color changes. You look for shape changes. And then I'll just show you that is pretty much, that's it. Difference in color, different color on the ear and different shape changes. And then that will tell you what's wrong with the body. Very simple. So highlight that on your notes, color and shape. That's what we're looking for, all right? So that's what the visual diagnosis, when you look at the ear, you can tell. Now, the next one is palpational diagnosis. So she uses a probe like this, or she actually uses this one. This is her machine. She uses this machine as a probe. So this is her little portable electrical detection machine. Somebody asked me, what is the difference between this and, you know, the other more sophisticated machines? To be honest, I don't know, but I have her contact information at the end of the notes. You can call Ruth and ask her or email her. So this is the end that you let the patient hold in the arm. And then this is the probe. Can you zoom in, Sam, a bit? So this is a hard probe. So when you touch the ear, different parts, it will have these kind of sound, either very light or very strong or very high pitch. So the higher the pitch, the more severe the problem. The lower the sound, the less the problem or milder. And if there's no sound, that means there's no problem. And also what she's looking for is she's looking, you know, as she goes through the lines that I was telling you earlier, you know, the 1 to 10 different systems, like for example, the digestive system. So the digestive system, she's gonna go along the middle of the ear, right? In this U shape. So when you do that using a probe or using this electrical machine, any place that you're pressing, because she's not doing the dot by dot like this to diagnose, like, you know, right? Because here's the mouth, here's the esophagus, here's the cardia and stomach. She's not doing dot and then go to the next dot and then go to the next dot. She's actually tracing it like this and applying pressure and going along in that line to see if there's any kind, if she feels any abnormality, and also if the patient feels any pain. So that's palpational diagnosis. So that she will talk about in her class. I won't talk about that, but I just want you to know there's such a thing because there's some things you cannot see, right? Okay, so right here, I also talked about a little bit. One is the tenderness too. I forgot to say is the press marks. So when you use the probe, there's certain areas on the ear, when you push on it, it should rebound back quickly. But if you see edema, which means you push on that point with the probe and that indentation just stays there, that is edema. And especially if the ear looks a little swollen to you, then yeah, there's some sort of inflammation or water accumulation in that area of the body. Okay. Now next, palpation. We can use our finger or we can use the probe. We're looking for deformities, any kind of protrusion or nodule, extra growth like fibroid cysts, tumors. Sometimes when they're small, you can't see, but when you palpate the ear, you will feel it. So if you use your finger and just kind of, run along your own ear. Okay, I'm going to come up to the camera and show you. I think it's better. Can you see my ear? Okay, so I have an ear seat there. Okay, so if you run your own finger, run it through, or from here, this is the cervical area. Run it. Oops. I think it's kind of hard. Let me put my microphone away. I use two fingers. So one, you need to hold it. So use your thumb on the back of the ear to stabilize it. Hold the ear like this. Then you can start feeling different parts of the cartilages. Is there any place where you feel that is hard? So I put one here. This is where my spleen area is. And on my right ear, I put one also on the liver and gallbladder because I tend to have liver qi stagnation. So you can feel it. I feel a little cord where my duodenum is, and I know exactly what that is. So then you can feel the bottom too. So there's only so much you can do with your finger because the finger is it's big, right? But if you have a probe, you're using this probe to detect different parts of the ear. You can feel the little subtleties. If there's a little hardened nodule or a little piece of ball or whatever, and that all has meaning. So pretty much it's either protrusion or nodule, or it's like a steel wire, like a cord that I put there. That's some sort of like scar tissue or injury or hypertrophy. That's what a cord is. It feels like a steel wire. Or it could just be an indentation. Okay, so we're not going to go over palpational diagnosis today. And then number 3, there's the electrical resistance finder. Kind of like what I showed you earlier, it will have the sound, the loud beeping sound, high pitch sound is more severe, low pitch sound is not as severe, and no sound is the best. That means no problem. I put a the link over there that you can take a look at the 2 different machines she has. And also I put there a demo of the class that we had about 10 years ago, where she diagnosed the patient. And that was the class when she was able to tell if the patient has a lateral knee pain or the medial knee pain. So you can see her use the machine to do the diagnosis. All right. And then next, okay, somebody asked this question earlier. Can you tell if the patient is about to have an appendicitis? Yes, because the ear will record what happened in the past. So any kind of past disorder that you've had, for example, a duodenal ulcer. I probably had it. I didn't even know because I could feel a cord in my duodenal area. And that is a past history that has occurred. You will see it on the ear. So if you had injury, to your back, and if you broke a bone or any trauma or whatever, it will be recorded on the ear. So your medical history is pretty much written all over your ear. You can see also what's happening right now, because usually that is going to be the point that is red, or that is going to be the point that is painful. So that's what's occurring now. And you can also predict what is going to happen in the future too, because there will be minor signs and symptoms that are not so severe that will grow into something that is more severe in the future if you don't address it. Okay, so when you are looking at the ear, you don't want to use any kind of LED bright, fluorescent light or any kind of yellow light. Natural light would be best because you're going to have altered color and then that's not going to be accurate. We found that to be very important because when we recorded the class with Dr. Huang, some of the slides on the on the TV appear to be different color than what's on the PowerPoint. So that has to do with the calibration of the monitor. So the same thing, if you're asking your patients to mail you a picture of their ear, you want to evaluate, it's better if you tell them to take it under natural light. Okay, so I'm going to go over exactly what you're going to see in the ear. Okay, we might run over late today, but by a little bit. What if you see capillaries? Yeah, we're going to go over that. So now let's go to the next slide. Okay, so before we go into specifically what you're looking for, this is a problem I had when I was learning from her at first. She showed a bunch of pictures in class 1 and 2, and I thought, she said, look here, this is this disease. Look there, this is this disease. And I thought, what are we looking at? I don't even see what's wrong with the ear, because so in order to know what you're looking at or what's abnormal, we had to first know what is normal. Okay, so take this picture and look at it later carefully, because this picture is what is supposed to be a normal ear in terms of shape, color. So whatever is supposed to be protruding on this ear is protruding. The angles are correct, the protrusion, I guess, what do you call that? The size is correct. And the indentation areas are supposed to be indented in the right areas. So pretty much, there is no place that should be indented that is protruded. Like for example, the triangular fossa, right? Triangular fossa, is supposed to be a fossa, so there should be indentation. But if you see this place is flattened, then something is wrong. Something's wrong. So same thing here in the heart area, there's supposed to be an indentation, right? This whole cavity is a cavity. But if you see it filled up, something's wrong. Okay, so let's go to the next picture. Now a normal ear is supposed to be smooth. Color is even. You don't see any drastic different color changes. Normal depressions, protrusions, curvatures are supposed to look like this normal ear. Okay, later in about 5 minutes, you're going to see a lot of different abnormal ears. Let's take a look at one. Okay, now this one is definitely abnormal. I start with the most drastic picture. This is a genetics, hereditary abnormal ear. So we're not diagnosing any disease here. That's just an abnormal ear. It's congenital. Okay, so this one is abnormal too. So where is it abnormal? Quickly, I'll show you. It's abnormal here because a lot of vascular dilations, right? That's abnormal because you don't see that. You don't see that over here. But this normal ear is it's like a teenager's ear. The younger the patient, the more normal the ear because they are still young. They haven't been through any diseases or any trauma or whatsoever. But this one on the right, oh, gee, something's wrong here, right? And also something's wrong here. What's wrong? Do you know? Like if Dr. Huang were to tell me, look here, oh, something's wrong with the cavum concha. So what are we looking at is this cavum concha, relatively speaking, is a lot larger, right, than the Simba. So you're supposed to have this kind of ratio, like you see on the left, but this cavity here is a lot bigger. Now, what does that mean? What is this cavity? Do you remember what system? That's the respiratory and the cardiovascular, right? So that means this upper body here, upper jaw is a lot larger. So whatever the problem she might suffer from, may be from that. So that is also like a abnormality of anatomy. Okay, so let's go to the next picture. Stop. Okay, so now this one, what is abnormal here? Can you guys type into the chat room? Can you see? This is very obvious that it's so abnormally red, right? I mean, it should look like this. It should not look like what you see on the right. That's too red. And when it's red everywhere like that and it's swollen like that, that means there's just a lot of heat, a lot of inflammation going on. Okay, next. What's on the left is normal. What's on the right is not normal. What are you seeing here? That's abnormal. Lots of things, right? We can go in one by one, but pretty much if you look at it, this ear looks pretty wrinkled, looks pretty withered, you know, like it's shrunken. That means there's lack of qi and blood circulation everywhere in the body, deficiency, okay? And specifically, there's a lot more issues, but we'll discuss more of what the specifics are in the next few slides. Now, what's abnormal here in this year? This is abnormal, right? That is abnormal right here. Okay, so what's abnormal here is, I'm talking about the curvature. So this is where the neck is, right? So if you look to your left, now the normal neck should appear smooth and going upward like this in a very not so curvious angle. But if you look at this abnormal picture, right, see how the angle is a lot more. So that means this patient definitely will have neck pain, right? Because that's the cervical area. Now let's go to the next slide. Okay, what's abnormal here? Right here, right? You see it's so dark. What is this system here? Do you remember? Oh, this whole system here. Yeah, it's the GI tract coming from here, the U shape, right? And then the kidney system is here, right? So everything that appears so black here are the toxins in your body. That's abnormal. This is a drug addict. These are the, I guess the poison, the toxins from the drug that is residing in the body, in the GI and also in the kidney tract. Okay, so next. Now, specifically, I want to go over now what are we looking for now? Okay, this is the most important part of the class and also the most picture intensive class. Don't need to do a lot of explanations, just show you a lot of pictures. So you can see discoloration and vessel dilation. This is the most common. What are you looking at when you're looking at red and brown and white? Okay, can you write this down? Take some notes so it's easier to help you remember, but maybe you don't need to because it's pretty common sense. Red is just inflammation, right? Something's acting up, it's acute. Brown means something has happened already, it's healing, kind of like the scab, right? It's a chronic condition or it's a past trauma. That's what brown means. White means lack of blood supply, hypofunction, deficiency. That's what white is, okay? And then when you see vessels on the ear, you have red vessels, purple vessels, black vessels, green vessels, not so much, and sometimes pale vessel, but that's not really a vessel, that's a cord. It's like the steel wire that I was talking to you about. That is just a scar tissue, okay? So if it's a red vessel, same thing, that's inflammation, acute inflammation. If it's purple, that means it's a chronic stage, it's not as severe. That also means blood stasis. Black vessel, same thing, it's a past trauma, or it's not an acute, it's just dead blood. The darker the color, the more, I guess, a longer history it has been. Okay, now number 3, we're also looking for desquamation. Desquamation is pretty much just like a rash on the ear. A rash appearing on different parts of the ear will mean different things, different allergies, different skin problems, and I'll show you pictures and it'll be very clear. Number 4, we're looking for lines, creases, grooves, depressions. So that is deficiency or lack of blood flow, right? Because if there's abundant qi and blood in that area, it's not going to form a line. It's kind of like a river that dried out, right? You see the bottom of the river has a lot of lines. That's how you would remember this. On the ear, same thing. You don't have enough blood circulation to that particular part of the body. That part of the body will form lines and grooves, and you will see specific pictures very clear. And number 5, you have protrusions. Okay, so protrusion means actually same thing. You see a protrusion on a specific part of the ear, there's some sort of growth on that part of the body. Okay. And then finally, at the end, the dimples and wrinkles is another form of deficiency, a lack of blood flow. It's very similar to number 4, the creases and lines. Number 7, you're also looking for hair. Hair means there's good function, there's good blood flow. So, hair grows kind of like plants grow. And number 8, you have cords, and cords are just past traumas. And you will just see some examples. I'll show you pictures and you can go back to review them. But cord, you have to really palpate. You can't really see them most of the time. And number 9 is swelling and edema. Okay, so these are just an overview of what you'll find. You can always refer back. And then take a look at these pictures. Okay, now discoloration is the first one. It's gonna go over. I'll go over what they mean first and then show you the pictures. So same thing. These red discoloration can appear as a dot, a vessel, a stripe, or area, or all over the ear. I put this down. I don't really have to, but Dr. Huang is very specific. She can even tell like the direction of the vessel flowing on the ear, what they mean, you know. So I just kind of generalize the color of red, in what form it can appear on the ear. But you don't really have to know this either. You just need to know red means inflammation. If you see redness on the ear, some inflammation going on, some heat. And then same thing, white. White is usually an area or a lump or a cord, but you don't need to know that either. Later, when you get more advanced, you can come back and review this. But for now, just know white means deficiency, lack of blood flow. Brown, is usually a spot or an area. And that means like chronic condition. And black is what you saw earlier with the person who's on drugs. That is, it will cover an area. Okay, so let me start showing you some pictures and then you'll get it. Maybe I should have shown you pictures first and then summarize, but then, oh well. Okay, so here, this is just red everywhere. That just shows you there's a lot of inflammation. And in this case, Dr. Huang would bleed the ear. So now here is another picture of redness. Now remember earlier I was telling you red could appear in different forms. So this is in the form of a dot. Okay, so that dot here is on the uterus cervix point area. So that is cervicitis. So this is pretty much it. Visual diagnosis for auricular medicine. You need to just take what's on this chart and match what you see on the ear and then see what's wrong with that part of the body. I don't know. The hard part is trying to get the right organ, I think. Okay, the next one, red dot on the duodenum is duodenal ulcer. So it's this one right here. I'll show you the draw circle. This one right here. So this one, it doesn't look fresh red to you, right? So that means this is not an acute duodenal ulcer. It's more of a chronic one and it's healing right now. So it's like purplish black, more dark red. That's what that means. Okay, next page. Okay, so redness. Now this one, the redness is on the dizziness area and the lumbar area muscle. So this one here is the dizziness area. I didn't go over it, but you can see it on the chart yourself later. If you want to know where the dizziness area is right here, next to the occiput. Now, red here is not very obvious, right? So if you're a beginner looking at this, you'll probably miss this. But what you want to do when you're looking at the ear is you always want to kind of sit back a bit, and then look at the whole picture of the ear and then see if there's anywhere that looks particularly red. Because this one, it doesn't really look that particularly red right here, right? Okay, next ear. Okay, so this area here on the earlobe. Now remember the earlobe is the face, right? So this whole area here covers the upper jaw and the lower jaw. So does this look like bright red to you or dark red to you? Can you put in the chat room what you think? Looks bright red to you? If it looks bright red to you, that means the patient must have a lot of pain right now, probably like peritonitis, maybe even TMJ. So bleed the ear. And if it looks dark red to you, then that means it's not so bad now, right? It's healing. To me, it looks more like it's dark red. So this is what I mean about the color of the ear under different lights. Now, your computer monitor and my computer monitor may not be showing